healthy.
Did you know that congenital heart defects are the most common form of birth defects among children, affecting about 1 in 4 children born in the world? Today, I'm going to be talking to you about congenital heart defects, specifically hypoplastic left heart syndrome. According to the Congenital Heart Defect Foundation, hypoplastic left heart affects about 3% of all patients diagnosed with a congenital heart disease. The purpose of my speech today is to educate you guys about the 3-stage palliative surgery process needed to have a better life for these children. First, I'm going to tell you about the basic anatomy of the heart. Your heart is made up of 4 chambers, 2 atria and 2 ventricles. The ventricles act as the pump that will oxygenate your whole body. First, your blood goes through your right atria into your right ventricle. It's deoxygenated. So this is when it goes into the lungs from the right ventricle and gets all the oxygen it needs to nourish your body. Once it has all the oxygen molecules, it will go back into the left ventricle and the left atria and into the left ventricle and be pumped out into your body. Unfortunately, with hypoplastic left heart syndrome, these children are born with a smaller left ventricle. If you break down the word hypoplastic, it basically means small. So they are born with a small left heart, specifically the left ventricle. This is a problem because your left ventricle is what oxygenates the rest of your body. So when these babies are born, they need to have surgery immediately. And that's what brings me to the first stage of this palliative operation, called the Norwood. The Norwood procedure is the first procedure, and it should be done between 3 and 5 days before the patent ductus arteriosus closes, which is oxygenating this patient's body. They have to reroute the patient's heart by constructing a new aorta so that the oxygenated blood can circulate the body. After about 3 or 4 months, or if they're showing signs of any deterioration, these patients will come back to the hospital and have the second stage, which is called the Glen. The Glen is a more complex procedure as they have to take the pulmonary system and the systemic system apart from each other and to oxygenate the body. This procedure will usually last these children up until the age of 5, maybe less, maybe more. After that, they come back and they have what's called the Fontan. The Fontan reconstructs the heart back to a normal flow and will last these children until they need a transplant. Unfortunately, these children will always need a transplant because their hearts in the Fontan procedure will fail. It's a sad case because these kids are always in the hospital. But if we can do what we have learned to make these lives better, then that is the way we should do this. That is all I have about hypoplastic left heart syndrome. There's so much more that needs to be known and so much more research that can be done to help these children live better, more fulfilling lives. But until then, I will do my best as a registered nurse to help these kids in the times that they need me most. Thank you.
Very good. Woo! I didn't know all that stuff.
Yeah.
Very good.
Very nice.
I feel bad. Are you going to be a nurse just for children?
Pediatric nurse, yeah, that's good.